What do raw blood test results mean? Imagine trying to solve a puzzle where each piece gives you a clue about what's happening inside your body. Blood tests for rheumatoid arthritis are like those clues, helping doctors understand if RA might be part of your health story. But no single test can give a complete answer on its own. Instead, doctors look at several markers together to build a clear picture. One of the main markers is rheumatoid factor, or RF. This is an autoantibody, which means it's an immune protein that mistakenly targets your own tissues. If your RF test comes back positive or abnormal, it suggests higher levels of this antibody, which is often seen in rheumatoid arthritis. However, RF can also be elevated in other conditions like certain infections, other autoimmune diseases, some cancers, and even in healthy older adults. If your RF is negative or normal, it doesn't completely rule out RA because some people with the disease are RF negative. Generally, RF levels that are more than 3 times the upper limit of normal are more strongly associated with RA, but false positives and negatives are possible, so results need to be interpreted carefully alongside your symptoms. Another important test is the anticyclic citrullinated peptide antibody, or anti-CCP. This test is more specific to rheumatoid arthritis. A positive anti-CCP result makes RA much more likely, especially when combined with a positive RF. Interestingly, some people with RA test negative for RF but positive for anti-CCP, which supports the diagnosis of seronegative RA. This test helps confirm RA when other signs are present. Doctors also measure inflammation levels using erythrocyte sedimentation rate and C-reactive protein. When these are elevated, it indicates active inflammation in your body, which is common in RA. These markers help assess how active the disease is and how well treatments are working. But they are not specific only to RA, so they are just one part of the puzzle. A complete blood count can reveal anemia, which is common in RA, and help monitor side effects from medications. Metabolic panels check kidney and liver function to ensure that treatments are safe for you. Newer tests like the Vector score look at multiple biomarkers to predict how your disease might progress and help tailor your treatment plan, but these are used alongside traditional tests. Putting it all together, if you have positive RF and anti-CCP tests along with elevated inflammatory markers and symptoms like joint pain and swelling, your doctor will feel more confident in diagnosing RA. But if these tests are negative, it doesn't mean you don't have RA, especially if your symptoms persist. Rheumatologists often need to evaluate your entire clinical picture, including physical exams and medical history, to make an accurate diagnosis. Remember, these blood test results are tools to help guide your treatment and monitor your disease over time. They are part of a larger process that includes your symptoms and physical exam findings. Always discuss your results with a healthcare professional who can interpret them in the context of your overall health. Each person's experience with rheumatoid arthritis is unique, and your doctor will work with you to develop the best plan for your needs.